Hey guys, you're going to want to listen to this next story. All week we're telling you the devastating consequences of Obamacare, and today it's hitting the men. Right now, 23-year-old woman pays over $30 per month in coverage, more than men. For guys the exact same age, but those costs are about to go skyrocketing. Here to explain is a co-founder of American Doctor for Truth, Dr. Jane Hughes. Welcome. We've got a lot to go here. This is an interesting fact. So the guys are going to end up paying the bulk of the cash moving forward with Obamacare. How is it affecting men directly?
Well, Obamacare is affecting men directly. Let's take the 40-year-old single male. He's a very low consumer of health care products. And under the new law, enter Obamacare, rather than a very small health savings account and a major medical, very inexpensive policy in case he has a medical or surgical disaster, he's asked to step to the plate and purchase one of the new government-approved insurances. And according to the Government Accountability Office, these new premiums are going to average, out of 8 states they looked at, about 122% higher than currently the cheapest policies are available for in the private market.
I want to look at some numbers here. We have the sticking it to men, current monthly average for a 23-year-old, if you check this out here, is $145, right, the premium. And we have men ages 30 to 39. It's up 49% in terms of premium. And 40 to 40, up 16% here if you're 40 to 49. 30 to 39 is up 49% as well. I mean, was this something that was a mindful decision in terms of the government, knowing that they could make a little bit more here with the guys?
Yes, it was a mindful decision, because if you look at the new mandated health policies the government approved, they are including essential health benefits. And those essential health benefits include maternity, pediatric dental and vision, contraceptive services, and free birth control pills, none of which our 40-year-old or under young man needs or wants. So most of those guys are really going to probably opt out, pay the fine, especially for the next 2 years, and remain uncovered, because it's an economic disincentive. And it's necessary, though, for the rickety economics of the bill to proceed forward with those young men buying those more expensive policies to subsidize other demographics.
So they're seeing their long-term wallet here.
They're seeing
the guys.
Yes.
It's really unfortunate here. What about the older set of men? I mean, are they also going to be bearing it for the short term, right?
The older set of men has a different set of kind of unfair impact of Obamacare. If we take a look at the Medicare-aged men, and by the way, this law impacts all men in America other than, of course, our own Congress, men in Congress and their staff, because, of course, they've been exempted from some of the pain of the Obamacare law. But older gentlemen who are in Medicare, this bill takes $500 billion out of Medicare to put individuals on Medicaid. So they are subsidizing the Medicaid. And how this specifically affects men in that age group is through the rationing and the dictates that are going to come from the central planners, who have already said that the PSA test is not necessary for these men.
You know, we want to know what you think, too. Send us some tweets over here at Fox and Friends and emails. Are you willing to bear the brunt of the cost? We want to thank Dr. Jane Hughes for being with us today.
Thank you so much. It's been